Good morning, virtual doctors. My name's Lawrence Mwiya from Itezhi. I'm the clinical care officer. Today, I want to submit a video on the 5 e-learning platforms that I have seen on the virtual doctors device. I've not only seen them, but I've learned through them a lot from the time I was introduced to virtual doctors 2.5 months ago. The first e-learning platform that I've seen and I've enjoyed is iRacers. iRacers, I've seen that is purely to help us manage critical conditions in our patients outside the hospital health center environment before they are brought to us. So the adult resuscitation guidelines have picked on the basic life support. Basic life support can be given by anyone who has been enlightened, anyone who is knowledgeable, to an adult who suddenly falls sick and has difficulties in breathing. Once you ascertain this, you immediately call for help. You can call the ambulance or call an emergency number in your locality. Whilst calling for help, you have to immediately commence 30 chest compressions, which you compress above the xiph sternum. You can measure 2 fingers above xiph sternum and compress with your 2 hands locked together. 30 compressions. Once you are done, you give an adult 2 rescue breaths. 2 rescue breaths can be given using a mask or a clean cloth in case you don't have a mask. You tilt the head, jaw thrust, open the mouth, then provide 2 rescue breaths. You continue with compressions until the help that you called comes by. Once the help has arrived, they will connect an EAD, automated electronic defibrillator. This device will read the heart and interpret. If the person has suffered a shockable rhythm, this device will be able to interpret and give prompts, and it will deliver the electrical shock to restart the heart. If the patient is suffering a mechanical heart failure, the machine will still alert you and it will advise you to continue chest compressions. So this adult will be taken to the hospital and probably be connected to advanced life support machines. The second example that I have learned several times that I do check on everyday basis is the SureFox. On the SureFox, there are so many learning platforms. I'll pick the example of the Virtual Doctors Forum. This forum, they provide us with information on diseases and how to manage them. They have provided us with information on how to manage COVID-19 patients. They have emphasized us that not all the patients need oxygen. It's only those who are critical, and in that case, you have to ensure you use a pulse oximeter. If the saturation is below 92%, these patients need oxygen supplementation to always keep the saturation above 96%. Very important and very educative. The third example I have picked is on Medscape. Medscape is another e-learning platform on virtual doctors. Medscape is mainly to teach us on how to use different medicines to our patients. I've picked pethidine. Pethidine is an opioid and an analgesic. There are many of them in that class, but I've picked pethidine. Pethidine can be used to manage moderate to severe pain in theater in patients who have undergone surgical interventions, usually given in the dosages of 0.5 to 2 milligrams. Can be given intramuscularly, intravenously. When you give it intravenously, you must be careful because it causes respiratory depression. So always when you are giving pethidine, you need to have the bag and mask, the oxygen source nearby in the event of toxicity, and also to have naloxone, the antidote, in case you suspect you have given an overdose of pethidine. The fourth example I've picked is on the Visual Doctors forum, where we submit challenging cases. For example, I recently submitted a case on rectal prolapse. I really benefited because the feedback really helped me and helped the client at large. So I've really seen that on this platform, as long as you submit challenging cases, the doctors are readily available to provide feedback and educate you. The last one I've picked is on the monthly newsletters we receive on WhatsApp. These newsletters, besides showing us those who have so many cases, the best performances, it also brings out on the cases that were more challenging that particular month. So by reading through these cases, we also learn from them. Thank you very much. I end my submission on the 5 e-learning platforms. Thank you, Doctors, for your continued support.